that time in Arizona again, and we're seeing a ton of parvo come through, and all of the shelters in Arizona are like running around trying to figure out where we're gonna put all these parvo dogs. And just in the last 2 weeks, my shelter has treated 23 puppies for parvo. So I thought this was a good opportunity to kind of sit down and talk about parvo. So that is what we're gonna do today. And I'm gonna kind of take you through a day in our Parvo Ward recently. I was in there by myself for a day, so I thought I'd just kind of take you along. Canine Parvovirus is a highly contagious virus. It comes from direct contact with contaminated stool, contaminated environment, or fomites like people, clothing, bedding, bowls, things like that. So parvo is highly resistant to any environmental changes, so any heat, cold, humidity, anything like that. It's really resistant to that, so it can actually live in the environment for over a year, which makes it very, very contagious for any animals running around that land that are not vaccinated. So parvo mainly affects the GI tract, which is why testing is usually done by swabbing the rectum or sending out stool to a lab for testing. The swabbing it's kind of like your at-home COVID test. So we swab the rectum, you mix it with conjugate, you put it in the thing, you snap it, and then you wait like 8 to 10 minutes to see what your result is. So the reason parvo is so intense is that it attacks the lining of the intestines, and it kind of wipes out all of the villi and microvilli that's on the lining of the intestines, and it can also affect the heart. It also attacks other aspects of the immune system like white blood cells. Parvo has an incubation time of about 2 weeks, but it's normally within the first 48 to 72 hours that a dog is going to show symptoms. And then it's usually kind of like, let me tell you, within those first couple hours, depending on the animal, it can move really, really fast. I have seen a dog be fine, test positive, and the next day it's like completely tanked. So the main takeaway from that is that at the first sign of anything weird with your puppy, you need to take it to the vet. Time is of the essence at this point, because depending on what stage they're already at, it's gonna make treatment really, really hard. So any moment you see a diarrhea, any kind of behavioral change, like they're just not playing as much or something like that, they should go to the vet. So I feel like anytime any vet tech hears that there's a puppy that's having diarrhea and is vomiting, they think, oh, it's got parvo. And while puppies up to 3 months are the most at risk, parvo can affect any unvaccinated dog of any age. Even a senior who has never had a vaccine can contract parvo, and it can also be really fatal for them as well. The main symptoms of parvo are going to be diarrhea, vomiting, lethargy, lack of appetite. As the disease progresses, they can have abdominal pain and bloating, they can have a fever, they could be really dehydrated, and as it even more progresses, you're gonna see more stool that is just bloody and mucousy and not really stool, it's just like straight blood basically. There are a lot of shelters that are not treating parvo, and if a dog comes back with a positive parvo test, they will euthanize. Research has shown that if clinics have a designated isolation area, they're following appropriate PPE protocols, and they have the ability to designate that level of medical care, they can actually achieve an over 90% survival rate for parvo, which is huge. Another huge plus about treating parvo is that once a dog contracts parvo and survives it, they can never get it again. So it's kind of a good investment to treat these guys, because they won't get it again, they won't shed it again. So the main way to avoid parvo is obviously vaccinate, vaccinate, vaccinate. The main vaccination for parvo is called the DA2 PPV, which is protecting your dog from distemper, parvo, and then a range of other viruses like adenovirus and things like that. But that is the most important vaccine for puppies, because it's protecting them against all of these things that they are highly at risk for, and that can be severely fatal to them, especially with them being so young. So you always want to vaccinate, you always want to get on a good vaccination regimen with your vet to make sure that your dog is never going to contract parvo at any point in their life. So how do you treat parvo? So treatment for parvo usually goes hospital to hospital, shelter to shelter. It depends on what kind of treatment plan they want to follow. So when a dog comes up positive for parvo in the shelter, they are immediately isolated. Normally, these shelter clinics will have a designated ward, the Parvo Ward, where anything that is positive for parvo will go in there, and that's all that's in there. So normally if one is not positive yet but has been exposed, they will be separated from the positive ones to see if they actually will contract it or not. And then the positive ones go into the Parvo Ward. Usually Parvo wards have their own designated laundry, their own dishes, their own supplies. Everything is just isolated into that one area. So after they're isolated, they're kind of evaluated to see where they're at. They're usually placed on a regimen of antibiotics. Those antibiotics are usually injectable, either a one-time sub-Q injection or IV, multiple IV injections. Or if they're eating fine, they usually can go on oral antibiotics, but we don't want to rely on them because they might lose their appetite later, and then you have to kind of switch into injectable medications. So it's usually some kind of injectable antibiotic, and then they are usually started on fluids. The fluids are to kind of make sure that they are staying ahead of or making up for any fluid losses that they're experiencing through diarrhea and vomiting. Really want to stay ahead of the dehydration component because that is a huge thing that's going to hinder their healing process. A lot of clinics will use additives in their fluids as well to kind of help with vitamin replacement, help keep their blood glucose up, and make sure that they are, staying as good as they can while we try and get their appetite back and get their vomiting under control and get their diarrhea under control. Along with the antibiotics, they'll usually go on anti-nausea medication. They will go on some other kind of antibiotic or some other kind of medication to help with the diarrhea, just to help firm up the stool and help heal that GI tract. So as techs, our job is to monitor these patients to see how they're progressing, whether they're developing any new symptoms, and then treating those as they come up. So to start in the Parvo Ward, after I've drawn up all my medications, if I need any, I usually have to put on my full PPE. So PPE, if you have heard it throughout the pandemic, PPE is personal protective equipment. So that is things used to protect yourself from becoming a fomite, basically. So for parvo in our shelter, that means a long gown. Normally you have disposable gowns. Our shelter has implemented reusable gowns that we just run through our laundry. And we haven't had any issues with like spreading it or anything. So we have reusable gowns. We have reusable hair caps. So making sure all your hair is up in the cap so that it doesn't become a fomite, because your hair is a huge fomite, especially for respiratory illnesses, which parvo is not, but you don't want poop in your hair. So put it up in a cap, and then you usually have some kind of foot covering. A lot of clinics have kind of developed a system where they have shoes that are dedicated to their Parvo Ward and they stay in there, which is what we have. We have these long boots that I just step into. And then I also elected for a face mask just because using Excel when you're spraying the Excel into these shorelines, it's like really strong when you're breathing it in. So I just like to have a face mask to cover it. But a lot of people will also wear face masks because the smell of parvo poop is very specific and very jarring if you're not used to it. I am used to it, but it's still like a lot sometimes when you walk into the clinic and it's just like parvo smell hits you. So face masks are always good if you want them. Once I get in, I kind of check on everyone to make sure no one is in distress or needing immediate care, and everyone looked good today, so that was a plus. And then a major thing and any tip that I could give any, clinic that has a Parvo Ward, especially a bigger one, is to get noise canceling headphones. So one of our vets actually had a bunch of these donated to us, and they are a godsend because I can't even put the audio in from these clips because it is so loud. and with all of them barking, which I'm glad that they're barking because they feel well, but it is like tearing up my eardrums if I don't have these noise canceling headphones in. So I'm gonna include some clips that I've taken like over the last year of Parvo kids, but for this day in Parvo, I had 12 puppies and they were all the same litter. They actually came from a litter of 16 that we took from a partner, and 2 of them were negative, so they went somewhere else, and then 2 of them actually went home with some techs that were working at that place because I think they were more stable, so I didn't need as much. But so yeah, we took 12 of this one litter. They've all got the same cooties. So one of the biggest things in Parvo is to monitor everyone individually, because we want to know exactly what is happening with each patient. So we need to know who is vomiting, who's not eating, who's having the bloodiest diarrhea, so that we can treat them adequately. So if we had like 3 in one kennel and there's vomit here and all of the bowls are done, but this one looks kind of crappy, like we don't know who's doing what. So we want to have them all separate. But we also don't want to miss out on that like vital social time that they have at this age. So a lot of shelters are putting various things in place to have that, you know, social time, have that enrichment time when they are feeling like up to it at least. Obviously, if there was someone who was super, super critical, they need to focus on healing, so they stay on their own. But if ones are like getting better and they're just waiting on retesting, then we want them to have like social time, social interaction. So at my shelter currently, we kind of do these little play groups, especially if they're all one litter. So I did 3 groups of 4 puppies, basically let them out, let them run around, play, do whatever while I clean. And that makes it easier for me to clean and kind of get everyone set up. And then I pull them each individually and do their vitals. So everyone gets a full set of vitals twice a day, which is our protocol. Some places have it, you know, more times, less times, depends on what they're doing. But for us, we do it twice a day. I will let them run around, pull them each individually, get their full vitals, and it's really easy when they're eating because I can just stick some food in their face, poke their butt, and it's easy peasy. But then I put them away, get them their breakfast, and they just kind of chill out after that, and we move on to the next group. So for this group, during their vitals, I was also kind of checking them over because the day after they got in, I noticed they were just covered in ticks, and I freaking hate ticks. They are like the worst thing to me. I'd rather deal with maggots than deal with ticks. Even with medication that we gave them to kill off their ticks, they are still like just crawling with them. I'm finding live ones that I'm picking off every day, and then I'm finding dead ones in their kennel. So it's just nasty. But I am kind of trying to check their ears and their paws just to make sure we're getting all of them off, because ticks can cause a host of their own things, and we don't want to deal with that if we can avoid it. So luckily with these guys, they're kind of reaching the end of their cycle. They are pretty well through the worst parts. So I only really had one that was kind of still critical, and she was just having some still bloody diarrhea, but she was like up, barking, you know, looking for attention, just having a little bloody diarrhea and just not eating. But I was super happy this morning because she did start eating. Just had a bowl out there while I was like checking her over, and she started taking some licks, and I was just so happy. So before this day, I had been syringe feeding her a little bit because one of the main complications too with advanced parvo is called GI stasis. So basically, if you're not, you know, having food go through your gut and your gut isn't making all those contractions and movements to move everything through, it just kind of slows down. And even though nothing's going in, still nothing's coming out. It's just sitting in there, and they can have GI sepsis, which is basically another infection on top of the parvo, and it's really not a good combination. So syringe feeding kind of helps, you know, encourage that motility to keep going while the antibiotics are doing their thing and fighting the infection. So she had been on fluids for a couple days. She was on her anti-nausea meds. She's on some new poop meds, And this was really the last hurdle for her, is just to get her appetite back, to keep her gut moving and get everything flowing. So I was super happy that she kind of took that last step and got through it. And she was still weak and not super playful. She kind of found a little bed on the pile of dirty laundry and just kind of watched everyone else. But she was much brighter than she has been, and you can tell she is making the turns. So all of this was just the morning routine, which on this day, even like without filming, it would have taken me what it did, which was like 2.5 hours. That's really like a huge amount of time to devote to just these patients, but you're making sure they're clean, making sure they're fed, making sure anything else that they need happens, like medications, fluids, catheters. You're doing the dishes, you're doing the floors, you're making sure you have clean laundry stocked and other things like, you know, medical equipment stocked. So then throughout the day, we're kind of checking if anyone is on fluids. We're making sure their fluids are flowing well, their catheter is good. We are maybe syringe feeding in the middle of the day. We may be retaking their temperature and, like, you know, fixing their kennel. If they have a fever, we're gonna put in a cooling mat and take out more of the blankets, and, you know, make sure that they have maybe ice packs in there or something. And then we are also spot cleaning wherever we can, because, like, you know, the good thing about being in there all the time is if someone poops, you just grab it, and we avoid all the poop on the bars and smeared everywhere. So obviously I was not only doing Parvo for this whole day. I was in our ICU, which means I have other things to do as well. So it kind of got away from me, but because everyone was stable, it was really easy in the PM to just like spot clean, throw everyone food, throw everyone meds, and then do the dishes and take the trash out. So it was pretty easy day. You know, there have been times where, like, even with today being an easy day, I was there 30 minutes after I was supposed to leave, just to make sure everyone was good and getting what they needed. So it is a lot of time to devote, you know, to these patients, but they are usually the most critical ones in the shelter that need all that time. And I always, when I'm in there, even if they dump their water 3 times, I refill it. I want to make sure their bedding is comfortable. I want to make sure they are, you know, have toys and things like that, because I really feel like mental state is as big of a healing process as the physical stuff. So I want to make sure that my patients are the most comfortable and clean and taken care of as they need to be. So that does take a lot of time and is a lot of hard work, but I love it so much. Just to see them like on the brink of death, and then later see them get better, and then see them running around being a normal puppy, having the time of their life out in the world, is just like the best thing to me. It just makes my heart sing. Even though there are a lot that end up not making it, that's kind of a big thing with people who aren't as familiar with the process. And I think that's also a big thing too with why certain shelters might not be treating it, is that the losses can be really high depending on when the animal comes in and can get treated. Even if you've done everything you can, you might just not have gotten there in time. And that is really hard. I have had multiple days where I've walked in and looked through the window into the Parvo Ward, and everyone's jumping and barking and doing great, and one is not moving. And so that gets really hard. You know, we've given them their best chance by bringing them in and starting treatment, even if it didn't end up well. And that's all we can really do. And I would rather work as hard as I possibly can and do as much as I can to give them their best chance to hopefully make it, rather than look at this puppy who has just a little bit of diarrhea, but euthanize them just because the test is positive. So that's where I'm coming from, and I know that that's kind of a privileged place to come from, because all of the shelters I've worked for treat Parvo, like it's their protocol to treat it, and so that is a privileged place to come from. But I think that's also because I've worked with shelters who partner with other shelters that don't treat it to bring them in and help them with that caseload and give them a chance. I think it is important to know that this is, even though it's not curable, it's preventable and treatable, and with over a 90% survival rate with treatment, I think it's worth the risk of maybe not having that high of a live release rate, but doing our best for these puppies that deserve the best life that they can live. So I think the biggest thing that you can do as the public is just spread the word about Parvo, spread the word about vaccines. There are a ton of community vet clinics doing great work trying to educate about the importance of vaccines. And then there are a lot of mobile ones as well that are going out to rural communities and, you know, trying to vaccinate populations and get ahead of this virus that just lives all around us all the time. The more we can vaccinate, the more we can, you know, lower the frequency of animals contracting the virus, and then it's going to eventually die off, but we need to be really vigilant about our vaccine practices. Another major thing you can do is just support your vets and your techs and all of the support staff in veterinary medicine. A major reason I wanted to make this video is so that people know that there are organizations out there working so hard to fight this horrible disease through education, but through like on the ground treatment in the Parvo wards and in shelters in general. We are actively working every hour of the day against this. It's not like, oh, they have Parvo, let's just, you know, poke them with a bunch of things, put them in a kettle and see what happens. If they are so far gone that we know that treatment is not really going to work, we're not making euthanasia decisions lightly. We are looking at this, doing as much as we can, but we're not going to let them suffer if the end result is going to be the same. I feel like this is really an unseen battle because no one really sees these puppies until they're cleared and healthy. You are not going to see anything about a Parvo ward on a shelter's website. You might see that they have one, but you're not going to see what's going on in there at all. You know, there have been times when no one else in the shelter outside of the clinic knows about these animals at all. Like, no one knows how many animals I have in Parvo, and no one knows what they look like or what they're like. I mean, there have truly been times where I have seen an animal, like I am the only one who sees them, and then I am the only one who is there when they pass or when they are, you know, actively dying and we need to make a euthanasia decision, and I'm the only one there who's holding their hand and giving them a last treat, and I'm the only one who's seen them the whole time they've been in the shelter through the rest of their life, basically. And these are animals that no one really cares about until they come into the shelter with a disease and have a staff that's willing to fight for them. And that's why we do what we do, and that's why I do what I do, and that's why I'm here. So I just want you guys to know that there are these people and these things happening, and even if you don't see it, this is happening all over the country, all over the world, actually. Parvo isn't just like a US thing. So if you've made it this far, I appreciate you so much. If you have any questions, feel free to leave them down below. I would love to continue this conversation. And if you have any other questions, feel free to leave them below. Thanks again for watching, and we'll see you next time.